Ciao mondo, hello world, hola mundo, hello monde, namaste, konnichiwa, ni hao. We are here in San Diego with Danielle Elise Soranno, an old friend and in this case, chair of the new ADKI session for consensus on sex and gender issues in AKI. So can you summarize most of the resolutions, although we discussed for 3 days, in few seconds, few minutes, what did we came up with?
Sure, well, first of all, it was a big honor to hold the 33rd ADKI on the role of sex and gender in acute kidney injury. We had 5 groups. We evaluated what's known and what isn't known, what are the gaps. We really thought about sex as a biological variable, focusing on preclinical models. A lot is known about sex hormones. Much less has been done to investigate the work of sex chromosomes and the impact on acute kidney injury. But beyond that, how are we investigating and translating these concepts to our clinical research? And what might the role of hormonal changes across the lifespan, for example, prepubertal, postpubertal, premenopausal, postmenopausal, how might all these important considerations impact your risk and your recovery from acute kidney injury? And so what would be the best way to analyze data? How should we think about setting up our clinical trials and our retrospective studies and our prospective studies? And beyond sex, we also considered the role of gender, and there's actually quite little known about the role and potential implications of gender as a social determinants of health, and how patients might be able to access care or not access care based on their gender identity. And so we had a lot of questions, great discussion, and I hope people are looking forward to the report that we put out, and hopefully we can make people feel a little uncertain and less confident in how we're thinking about sex and gender in our research, because I think we can improve our rigor if we take these into account.
My feeling and my take home is that as in previous ADKIs, I'd like to remind that when we started with the rifle criteria, we had no data, and that was a tremendous input for new studies and new developments. In this case, this type of ADKI probably will be the starting point for many different studies, including drugs, techniques, including analysis, both in preclinical models, pharmacological kinetics in men and women, etc., and also in all the story about the social impact of gender identity rather than simple male and female as a biological variable, because we need to make sure that there is no discrimination, there is no treatment deprivation related to sex and gender, etc., etc. So this will be a kind of new responsibility we're taking to teach the world that this is an important issue, and we should work on this to make sure that in the few years what is known will be a little more and what is not known will be a little less. With this is not a cappuccino, it's a white wine cappuccino, but still, thank you, Danielle, for organizing this and being chair, and again, another successful ADKI.